If you take or have taken prescription drugs, you know that getting access and being able to pay for them can be quite a challenge. But did you know that there are people working every day to help improve this situation? And their position is known as a PBM. Joining me now to explain, we have Mark Merritt, President and CEO of the Pharmaceutical Care Management Association. Mark, thanks for being with us.
Thanks, Robin. Good to be here.
So PBM, first of all, what is it? What does it stand for?
Well, it's pharmacy benefit managers, but what we do is we help control drug costs and give patients all kinds of ways to save money through home delivery of 90-day refills, through lower cost drug stores. We negotiate big discounts with drug companies on drugs to bring down the overall cost to patients. And the good news is there's a lot of savings going on, and even better news is there are things patients can do to increase their savings with just a little bit of effort.
All right, so who hires these folks, these PBMs?
Oh, employers, unions, government programs, anybody who's managing drug benefits. And of course, about 20 years ago, there really weren't many drug benefits. There weren't a whole lot of drugs on the market, but now they're a normal part of insurance. But it's a complicated business, and it requires some really aggressive negotiations against the drug companies to bring costs down, and also new tools that bring the pharmacy costs down by 90-day home delivery, finding affordable drugstores, helping people shop and save, and a whole bunch of other ways that people can save money. So we're there to make that available, not only for the patients, but for the small businesses, unions, and government programs that provide the benefits.
Okay, so that's coming from the PBMs. On the consumer side, is there anything we can do to maybe help the process, other things we can do to help save money on our prescription drug costs?
Sure, the simplest thing you can do if you have insurance, because we only work with people who actually have health insurance, it could be Medicare, anything. You have an insurance card, and on the back of it is a pharmacy services phone number. If you call that number where it says pharmacy services and members, you can just ask them, hey, how can I save money on drugs? Can I take generics? Is there mail service pharmacy available? Are there more affordable drug stores? Am I on the right network to get the drugs that I need? Most people never bother to make this call, but those who do can easily save 10 or 20% on their drugs simply by taking a generic, by taking a look at all the drugs that they're taking and saying, hey, gosh, I didn't know one doctor prescribed the same kind of drug for the same treatment that another doctor prescribed 5 years later, and I'm taking 2 drugs for the same condition. I can get rid of one of them and save some money. So there are all kinds of ways to save, but patients do need to pick up the phone and call. And if they do, I think they'll find there's some significant savings.
I would imagine, Mark, that as you just say that, there are people out there going, I didn't even know that my insurance card had a back. That the only reason they may look for something is probably maybe a billing concern or something, right?
That's right, or you have the insurance card in case you get in an accident, and that's why I'm holding it up, because on the back there is that special information. It's really just an 800 number to call. They'll have all your formulary information. They'll know what drugs are the right prices, the right copays, the lowest copays. They'll know everything about what you need to know with your drug benefits, and they can walk you through this stuff. Often you'll be talking to a pharmacist on the phone or a clinician or other people who really understand what you need. And they can even call your doctors and work with you if you'd like to take a generic or like to get a cheaper brand drug for the same condition. They'll work with your doctors, and if your doctor thinks it's a good idea, they'll help arrange that conversation, either them with the doctor or you with the doctor, or both sometimes. So there are all kinds of ways to save. All you got to do is pick up the phone and call, and I think you'll find that significant savings is available.
All right, all great advice, Mark. I want to thank you for bringing it to us today.
Hey, thanks for having me, Robin. I appreciate it.